Has your view of cognitive therapy changed with the development of models and treatments like behavioral activation, dialectical behavior therapy, acceptance and commitment therapy?
Yeah, as far as behavioral activation is concerned, we actually used that term in our book, Cognitive Therapy of Depression. And when
1977, I think.
Yeah. So when you have a very depressed patient, they're not doing anything. It's really very important. And what we did is we had a daily schedule of activities, and we would have the patient make out the daily schedule, and then we would try to encourage them to put more things in the schedule. And so the behavioral activation is kind of the road also to getting at the negative thoughts. So a depressed patient would say, I just don't have the energy to get out of bed in the morning. I don't have the energy to do this and that. And then you ask the three questions. What is the evidence? And they say, because I don't feel. And they say now, is feeling the only thing? So let's test it out. And so I got into behavioral experiments. And this is something that we have used as a kind of subset of behavioral activation. Behavioral activation really means getting the patient to be active. And so just being active in itself may not prove anything, because what we want to do is to change the cognitive structures. And one of the cognitive structures would be that I am so weak and helpless that I can't do anything. And so if you get them to do something, you have to ask, what does that prove? What does that indicate? You thought before you weren't able to do anything, and now you find that you can do something. So behavioral activation in itself is not sufficient to really go all the way. It'll get the patient to do things more, but it may not change their basic thinking as much.